I sure hope this doctor is better than the last one.
I hope so too, but you haven't been taking very good care of yourself, and I know you're not following your diet, and you drink Diet Mountain Dew like it's going out of style.
Yes, but you eat a lot of cookies.
Okay. Good afternoon. I'm Dr. Stearns.
Hello,
Hello.
Dr. Stearns.
Hello. So what brings you in here this afternoon?
My daughter.
We're here because he hasn't been taking care of his foot. It's been numb for a while now, and it's starting to change color.
Your foot. Well, we're going to take a look, and we're going to see what we're dealing with down here. See what's going on. Feel that? No? Not really? Okay. Okay, so your chart here shows that you have a history of COPD, congestive heart failure, and hypertension. And you've also been a diabetic now for about 20 years. So tell me, how have your sugars been?
I haven't been checking it regularly. 3 times a week. I'm running around 300. The metformin I hate, and I hate pricking my fingers. It hurts.
Well, have you been taking your meds and watching your fluid intake?
I've been taking the insulin most of the time. It's trying hard, but it's hard to get it into the needle, and how much, I can't tell how much I'm doing, and the metformin's making me sick, and I don't like it, and that kind of, it just doesn't work.
Okay, so you've been kind of just eyeballing the insulin?
Eyeballing it and trying the best I can.
And how about your fluid restrictions?
I'm really thirsty all the time. I've been drinking a lot of Diet Mountain Dew, but it makes me so darn thirsty. I'm thirsty all the time.
Diet Mountain Dew. So how much Diet Mountain Dew have you been drinking?
3 bottles a day and 1 bottle at night.
Okay. Well, I'm a little bit concerned about how your foot looks. If it's okay with you, we're going to run some tests. We're actually going to do what we call a Doppler. It's kind of like an ultrasound, but it's not going to hurt. But we definitely have to do that today. And it's actually going to take a look and tell us how the circulation is of your foot. Well, I'm not detecting a pulse on your foot. How long has that been that way, and how long has it smelled?
Been like this for like 3 days, 4 days, and the smell's been there for about a week or 2, and I didn't feel you're touching it. Will it help if I change my medication, maybe put it up on a pillow, maybe rest it or do something with it, or?
I'm concerned about that infection and the necrotic tissue, plus with your diabetes and history. I'm a little bit concerned that we might be dealing with some gangrene here, so we need to take care of that today.
I just don't know what are we talking about, what's going to happen.
I'm going to call a surgeon, and he's going to get it up here right away, probably do some more tests, and he'll talk to you guys about it, but I think we might be talking about amputation here.
Let's put that off about a year, will you? I don't want to do that right now.
There's no time for that. We need to do this right now.
How much are they going to amputate? Where to? I don't heal real well. I really want to put this off.
There's going to be some pain, but we'll do our best here to minimize that. You're definitely going to be in the hospital for some time, but you know, once we get you up and going, hopefully you'll be on your way.
Do I have to wear a prosthetic, or will I have to be in a wheelchair, or what's the story?
Initially, you're going to be in a wheelchair once you heal up, but I think after some time, once you heal, you'll be able to be fitted for a prosthetic, and you'll be able to get around okay.
I'm not real crazy about the options, and I have no options, and what else can I do?
I'm going to call the surgeon. He's going to get up here this afternoon. He'll probably run some more tests, and he'll discuss everything over with you guys so that you're comfortable. But really the important thing is that you got in here today, because this needs to be addressed immediately.
We'll have to do what we have to do.
All right, thank you, doctor.
Okay, thanks.
Thank you.
It's a good thing we came in here today.
Hello, my name's Alana. I'm going to be your nurse. I'm going to help you get ready for surgery today. May I have your name and date of birth?
My name is Dale Biggs, and I was born 8/8/46.
Okay, and do you have any allergies to food or medication?
No, I do not.
Okay. Do you know where you are and what day it is?
Yes, I'm in the hospital, and today is October 2nd, 2013.
Great. And who is your physician?
Dr. Stearns.
You're very sharp today, Mr. Biggs. Can you tell me in your own words why you are here today and what's happening with your foot?
They're going to sedate me, put me to sleep, and the foot fairy's coming to take my foot away.
I'm really sorry to hear that. But the real issue is if we don't operate on your foot, you can get an infection and it could spread through your body and you could die.
That's why I'm here.
Do you have any objections to receiving blood if it was a life or death emergency?
I guess if I have to, it's okay.
Then I need you to sign this consent form with your blood product choice marked here. The doctor plans to put you under anesthesia for this surgery. Have you ever had any problems with anesthesia? And do you give your consent?
Yes, I give my consent and never had a problem.
I need you to sign this form. Now I'm going to need you to write the word yes on the foot that we're going to be operating on. This pen. Thank you. Your doctor ordered antibiotics to prevent infection and some medicine to prevent any blood clots for after surgery. Do you have any more questions for me, Mr. Biggs?
No, they're going to cut my foot off anyway.
I'm really sorry. The operating room nurse will be here shortly. She's going to take you down to surgery. Just let me know if you have any other questions. I really wish you a speedy recovery.
Thank you.
You're very welcome.
Elena, I really need to go. I can't wait for Maria any longer. Can I just give you a report? I'm running into overtime.
Fine.
All right, I've only got one patient for her. It's Mr. Dale Biggs in room 250. He's 67 years old, amputation of the right foot, history of diabetes, congestive heart failure, hypertension, of course not compliant with meds and diet. Smokes a pack a day for 50 years. He's 4 hours post-op awake, alert, and oriented ×3. He's got stable vital signs, dressings clean, dry, and intact. IV to the right AC, normal saline running at 100, and a PCA of morphine 2, 2, and 10. He's pretty good to go.
Okay. All right. I'll pass it on.
Thank you.
Oh no. Look at the time. I am going to be so much in trouble. I am so late. Elena, hi. Are you in charge today? I am so sorry I'm late. I know my kids were sick. The traffic was horrible. Do you have my report?
Yes.
Well, can you tell me anything about it?
I don't have time to give you a report. I'm behind on my stuff, so I suggest you get started.
Okay, great. Thanks.
Oh, look, you can start with room 250. His call light's on.
Okay, who's in there? Okay, thanks. I'll start there first.
Hey, Dad. How you doing, Dad? I really wish you would wake up and talk to me again, Dad. I'm starting to get worried, so I called your nurse. Come in.
I'm Mr. Biggs' nurse. Are you related to the Mr. Biggs?
I'm his daughter, Candy.
Okay, great, Candy. Can you tell me what's going on?
Well, he seemed to come out of surgery just fine. He was awake and talking to me a few hours ago, but for the past hour or so, he's been unresponsive to me, and I'm starting to worry.
Okay, well, let me just check him out. Let me see what's going on. Mr. Biggs? Mr. Biggs? I'm going to be looking at your bracelet. Let me get some vital signs here. Okay. And let me go ahead and listen to your lungs. Okay, you know what, Candy? I'm gonna make a phone call here. Let me get right back to you. I'm just gonna be stepping over here to the phone, okay?
Okay.
This is Elena. How may I help you?
Hey, Elena, it's Maria. I'm here in room 250 with Mr. Biggs. I think I'm gonna need a better report than what I received. Can you let me know what the outgoing nurse said? I'm seeing some changes here, I think.
Okay, let's see here. Mr. Biggs is a 67-year-old male. He's been admitted for an amputation of the right foot. He has a history of diabetes, congestive heart failure, and hypertension. He's non-compliant with his meds and his diet. He's been smoking a pack a day for the last 50 years. Let's see here. He's 4 hours post-op. He's awake, he's alert, he's oriented ×3. His vital signs are stable. The dressing is clean, dry, and intact. He's got an IV to the right AC with normal saline going in, what's the rate? 100 milliliters an hour, and a morphine PCA going in at 2, 2, and 10. You good?
Okay, well, hey, don't hang up yet. I'm a little bit concerned because I think what I heard you say that he was awake, alert, and oriented.
Yep.
Okay, well, I'm seeing a change here. He's not responsive to me right now, and his vital signs don't seem to be doing as well. His heart rate is 60, his BP is 159/91, his O2 sat is running in the 80s, right around 89, and his respirations are down to 8. He is afebrile still at 97.6, but I'm kind of worried. I think we need to call the rapid response team, and I think he's probably going into respiratory failure. Could you do that for me?
Yeah, I can page him now.
Okay, thanks a lot.
Uh-huh.
Hey, Candy, I just talked to the charge
Rapid response
nurse,
team
and
to
what
room
we're going to be
250.
doing
Rapid
is
response
calling
team
the
to
rapid
room
response
250.
team. The rapid response team is a group of people that come in. It's a respiratory therapist, ICU charge nurse. They'll be able to take a second look at him and just see what's going on. Okay?
Okay.
Okay, they'll be here shortly.
Okay.
Oh, great. Here they are.
Okay, I'm the ICU nurse. I'm Marianne. I had a rapid response team page at 912.
Yeah, Marianne, I'm Maria. I'm the primary nurse today. I'm just getting in here. Candy, can you tell us about how long he's been like this?
About an hour.
Okay, so this is Mr. Dale Biggs. He's 67 years old. He had surgery.
Dale Biggs. Dale Biggs.
He had surgery about 4 hours ago, and when I got report, they said that he was alert and oriented. Now you see what he's like. He's got a history of diabetes, CHF, hypertension. He is non-compliant with meds and with diet, and he smokes about a pack a day for the last 50 years. So he's been unresponsive for about an hour now. His heart rate is at 60, respirations 8, BP 159/94. He is afebrile at 97.6, but his O2 sats are down to 89, so I'm concerned about that. It's a really big change. So we gave you all a call because we really think he's coming into respiratory failure.
Okay, so you're saying he's fresh amputation? Yep. Okay, so he had some Lovenox on board?
Yes, he did.
Okay, all right, so he's not bleeding there. Okay, CA, what's our fresh vital signs?
Coming up right now.
Okay, O2 sat, how's it doing?
O2 sat is 88.
Okay, respiratory rate?
Respiratory rate is 8. Blood pressure is 150/98. Heart rate is 59.
Okay, RT, we're not getting too much action there. Okay,
No response, lung sounding wet.
Okay, you got an oral airway?
Yes.
All right, so we've got a diabetic patient here, CA, so let's go ahead and check his sugar.
Getting the blood sugar now.
Okay, RN, we've got some narcotics on board here, so let's try to rule out that as a problem. Let's go ahead and turn off the PCA pump.
Okay, we'll do that.
So keep stimulating him there. Here, we'll see if we can get some action going on. We've got a lot of things to think about on this patient.
Okay, the PCA pump is off at 9:14.
Okay, charge nurse, did you have an emergency page out to the physician?
I'll page him now.
Okay. Blood sugar is 150 at 9:15.
Okay, all right, so it's not the blood sugar. Okay, are we getting any movement there, RT?
No movement, no response.
Okay, all right, so let's go ahead and give some Narcan, RN.
Sounds like a good idea.
I've got some here in my emergency kit. Let's give Narcan 0.4 milligrams IV push stat.
We'll do it.
Okay, keep your finger on the pulse, CA there.
Yes.
Okay. Let me know when that Narcan is in.
I'll do it.